Hello, everyone. Welcome to our webinar entitled Evidence-Based Treatments for Autism Spectrum Disorder, or ASD. As you're starting to sign on, please trickle in the chat where you're logging in from so we kind of have a good sense of where everyone's located. If you also want to put down where you work, or if you're a student, what field you're in, anything like that could be helpful to help generate our conversations. So welcome, everyone. My name is Dr. Taryn Goldberg. I am a licensed psychologist in the state of Florida, as well as a nationally certified school psychologist. I am joined here with two postdoctoral residents in the field of psychology. We have Dr. Catherine Stubblefield, and we have Dr. Danielle Silver. We're also joined here by Mr. Dylan Braun, who is a clinical psychology trainee at our clinic. So we are located at Nova Southeastern University in Davie, Fort Lauderdale, Florida. Specifically, we are in the Mailman Siegel Center building at a clinic called the Unicorn Children's Clinic Foundation Developmental Assessment Clinic. So what we do is we provide psychodevelopmental evaluations to test children for autism, as well as other developmental delays. And as you can see, we also deliver community outreach presentations. Today, we're presenting on evidence-based treatments for this population who have autism. So with that said, I will let the team take it away.
All right, thank you for that introduction, Dr. Goldberg. We're honored that you all chose to spend some of your Thursday afternoon with us. Thank you. So today, we're going to be providing an update on the state of the evidence for treatments for autism spectrum disorder. We're going to describe the importance of using empirically supported treatments with our clients. And of course, we'll describe some of the main evidence-based interventions that are used in practice today. We'll also discuss some important considerations for both treatment providers as well as for families. And we'll leave you with some treatment resources and referrals so you have something to take away with you. So we have a lot of ground to cover, so I'll pass it along to Dr. Silver.
Okay, thank you, Dylan. So to start off, and you can all just type this in the chat, but I'm curious to know what you know about treatments for autism spectrum disorder. So let some of those responses trickle in. One thing to make note of is oftentimes what we do know about these treatments are coming from Google, word of mouth, the news. They're not always necessarily reliable, right? So we want to make sure that when we talk about treatments for autism spectrum disorder, that we are considering reliable treatments that have a lot of support and a lot of research. I see ABA in the comments. We'll talk a little bit more about that. Awesome. Behavior modification as well. So why don't we get started in talking a little bit more about some of those treatments. So when a parent first gets an autism spectrum disorder diagnosis for their child, one of the first things they might do is they might go to Google and start searching for available treatments. And this can be very overwhelming because if you do that, you realize that you come with over 300 million results. So again, that's a lot of information to kind of try and sift through and can be very overwhelming. More empirically, we're going to be looking at this study that was conducted in 2016. What the researchers found was that parents rated getting professional advice as the most influential source for deciding which treatment to use, meaning that parents are relying pretty heavily on the advice given to them by practitioners as to what treatments are going to be best for their child. And they also found that more than 35% of parents listed interventions that were not part of the national standards report. And the majority of parents only agreed with 9 out of the 26 identified treatments. So really what this is telling us is that parents don't really have a strong understanding of what the gold standards or the best treatments are for their child with autism. So what are evidence-based treatments and why are they important? Before we get started talking about that, what I do want to point out is a project It's the National Standards Project, which is conducted by the National Autism Center at May Institute. And the aim of this project was really to answer this big question: how do we effectively treat individuals with autism spectrum disorder? So this project started, I believe, in the early 2000s, and the first report, or the first phase, was released in 2009. The second phase is what is supplying the information that we're going to be reviewing here today, and that was released in 2015. And they are currently in the process of updating this information for phase 3. So we might see a few different changes, and that's going to be coming out sometime in the near future. So really, I mean, if we think about this project, it's great because it's a resource that can be used by parents, by caregivers, providers, educators, to really determine what's the best course of action for their child. One major benefit to know about these evidence-based treatments is that they really help to impact families, and they help children live more adaptive and independent lives. We're going to go ahead and watch this video. It really helps show the importance of early intervention.
16-year-old Paul Witzigruder takes autism one step at a time.
Paul is spunky, he's funny, he has a lot of energy, just in general, good-natured.
Paul was diagnosed with a moderate form of autism when he was 2. Soon after, his parents enrolled him in an autism school at Cleveland Clinic.
He started as a little boy who couldn't communicate, was easily frustrated and having tantrums, didn't know how to play with any toys, didn't know how to use objects functionally.
He was nonverbal, so they taught him, they taught him to eat, then his name. You know, you call his name and he'd actually look at you.
Research shows young children with autism benefit from early intervention. Over the years, Paul has developed adaptive skills and learned how to communicate and socialize.
We still think he has a lot of room for growth, but the things we're working on now are so different, you know, independent living and, you know, maybe he can have a job where he attends for 2 hours at a time.
That's where the family business comes in, a granola company inspired by Paul's dietary challenges.
He does a variety of things. He uses the Best Buy date gun. Recently, he's been filling some of the bags, which is a big deal because he has to have gloves on. He has to use a scale.
When you step back and realize how much effort it takes for him to learn something, it's unbelievable.
Paul has also overcome 2 organ transplants, a kidney and a liver, but you'd never know the adversity he's faced by his happy, helpful demeanor.
I mean, it really is kind of sweet and simple and pure. He has come a long way, and it's still like he's smiling all the time. He's totally in the present. I mean, we should all live this way.
At Cleveland Clinic, I'm Erica Foreman.
Thank you. So as you can see from the video, really the impact of appropriate and early intervention is profound, not just for the child, but for their family as well. So what is an evidence-based treatment? I'm going to be referring to evidence-based treatments a lot. So the type of services that we're going to be speaking about, they fall under this category of evidence-based treatments. And what that essentially means is that these types of treatments have shown scientifically that one group who got the intervention showed improvement, while another group who did not get that specific intervention did not improve in the same way. So if a child is going to be exposed to a treatment, there should be some evidence that it works, right? At least for a significant group of children. So for example, if you have a group of children with autism who have no words, and you want to know if a specific teaching intervention will help, there needs to be some sort of control. So it's important that what happens is the group is split into 2. One group gets an intervention, one group does not. And then in the end, you'll be able to compare what happened between the 2 groups. So you'll see that over here, even in the group that didn't get the intervention, there were 2 individuals who gained some words. And we would expect that because with normal passing time, they're going to be kids that learn on their own and that are able to gain these skills. But if we look at the intervention group above, 50% more kids, so a total of 4, were progressing to using 2 words, right? So we can say that there was a better chance of children learning words if they got this specific teaching intervention. So knowing that there is an overwhelming amount of information and research out there, the National Autism Center went through all of the research on these types of interventions for children with autism, and they grouped these interventions into 3 categories. Established interventions, which have been shown to be repeatedly effective, emerging interventions, which show some evidence of effectiveness, but not enough to make sure that they're truly effective. And then finally, unestablished interventions, which do not have sound evidence of effectiveness. And although it's important to treat every child as an individual, these evidence-based treatments have shown to be effective. So those established treatments, they're shown to be effective in wide groups of children with autism spectrum disorder, meaning that the more established and the more emerging practices are likely going to be more effective. Okay, so let's jump into some of these established treatments. So according to, again, the 2015 phase 2 reports, there are 14 established treatments. Most of these treatments are based on the principles of applied behavior analysis. There are some that come out of the special education and developmental psychology field, as well as medically based treatments to address challenging behaviors that are associated with autism. So if we kind of look through this list, we have some behavioral interventions. This primarily encompasses interventions that look at the antecedents of behaviors, so modifying those situational events that precede a behavior, as well as the consequences of those behaviors. Then we also have cognitive behavioral therapy, comprehensive behavioral treatment for young children. So this is kind of what encompasses ABA. So it looks at kind of early behavioral interventions that target a range of essential skills, whether that's communication skills, social skills, and so forth. Then we have some other interventions. We're going to primarily focus on ABA, but just to touch on a few, scheduling, right? So this kind of refers to the use of visual schedules that can essentially help these children increase their independence, as well as parent training, I'd like to point out. So that involves teaching parents effective ways to respond to their child's behaviors. So ABA is an evidence-based approach to treating individuals with autism and other significant behavioral disorders. One of the key ideas of ABA is to understand how the environment triggers and maintains behaviors in order to then change difficult behaviors so that they're more functional and more adaptive. And ABA is provided by trained certified therapists, and it can be conducted in a lot of different settings, like clinical settings, the home, school, even the natural environment. And ABA requires very intensive hours of therapy based on the severity and needs. It can range anywhere between 25 to 40 hours a week if provided in the home setting. So treatment goals include functional communication skills, general language acquisition, social skills, reduction of maladaptive behaviors, increasing appropriate play and leisure skills, enhancing motor skills, and so forth. And the instruction and the skill acquisition is really based on proven behavioral principles. So for example, positive reinforcement and functional analysis that are used to really shape the child's behavior. In terms of the ABA therapists, they must undergo pretty rigorous training and collect data, all while providing instructions and incorporating behavioral techniques to really help the child to improve. So here's a nice video explaining ABA in a little bit more detail.
So ABA is short for Applied Behavior Analysis, and this is a technique that's based on learning theory, and it has 2 aims. One is to teach skills, and the other is to try to work on problem behaviors or interfering behaviors. So the interfering behaviors might include avoidance of eye contact, sort of obsessive interests about strange things, sensory self-stimulation, like this kind of thing. And that can really interfere with developing social relationships and with learning from the environment. So there are, and then there are other problem behaviors, of course, like aggression or property destruction or refusing to do what an adult is asking. And those things can be targeted with things like planned ignoring, reinforcing alternative ways of expressing it. So there are a whole variety of behavioral techniques to try to really reduce these interfering behaviors. And then the other big main thrust of ABA is to teach skills that the children are not learning the way typically developing children are learning just naturally from the environment. So if you have a 3-year-old child with autism who is not yet speaking, just giving them normal language input has not been sufficient to trigger their language learning. So instead, you break down these complex skills into very small pieces, and you teach them one at a time with prompting, and then you fade out your prompting, and a lot of liberal use of all kinds of different rewards or reinforcers. And it's really amazing how fast some children can learn given these conditions.
Okay, so we're going to go ahead and talk about a few of the other types of interventions. So emerging interventions for individuals under the age of 22, and just as a reminder, emerging interventions are those ones that they show promising outcomes in some studies, but they haven't been studied enough to be fully confident that those interventions are truly effective. And it's also important to know when we're looking at this list that, something like exercise or music therapy, for example, they may not be effective at treating autism or categorized as a well-established intervention, but that doesn't mean that exercise or music may not be something that your child will enjoy or will benefit from. So something to keep in mind when we think of these emerging interventions. And then we have the unestablished interventions. So these interventions typically don't have enough quality research. Research hasn't necessarily been replicated, or not a lot of research has been published on the topic, or the topic has been studied and has been showed to be ineffective. So again, there's this long list of approaches that have been shown to be effective, right? And even emerging interventions. So really, it's a better option to not choose an intervention that is unestablished, but to focus on those emerging and well-established treatment interventions.
Okay, so thank you, Dr. Silver. Now we have some questions for all of you. Please type your responses in the chat and we'll try to address them. And also as a reminder, we'll have a chance to answer questions towards the end of this presentation. So first question, given the 2015 phase 2 update report that Dr. Silver discussed, as well as your own experience and your knowledge that you bring to the table, please tell us what stood out to you.
I think for me, some of the stuff that stood out, while we kind of wait for people to add their responses, definitely I saw that functional communication training was still an emerging, whereas I feel like that's something that we focus on a lot in, ABA. So, I guess just keeping in mind that this was done in 2015, so it'd just be interesting to see, that aspect. And then I think also the fact of animal-assisted interventions with being in unestablished, although we see oftentimes people trying to advocate for, therapy dogs for children with autism and things like that. So those were kind of the things that stood out for me. Absolutely. We've gotten some responses. So someone pointed out that a lot of the treatment interventions that are available are directed towards younger children, but there is a deficit when it comes to teenagers, adolescents, adults. And some people are surprised by the location of various interventions like music therapy or animal-assisted therapies. So again, this is from 2015. So
where sort of a thinking, 6 years down the line, where do you think some of these emerging or unestablished treatments will be in the next update? So as we're waiting for responses, I think that technology-assisted interventions were probably still in their infancy in 2015. So I'm interested to find out where those are going, and as we get more and more support for those kind of approaches.
Absolutely, especially now with telehealth and all the use of augmented devices, such as like the iPads for communication and things like that. And the sensory processing treatments, since there's more, out there about like the importance of sensory things for children with autism. So I agree with you, Dylan, for sure.
Okay, lots of responses. Big push for more support and more additional resources outside of behavioral modification. Maybe more targeted approaches, for example, the sensory aspect of ASD. So very interesting ideas. And then finally, what do you think will be added to the list? Where do you see sort of the next steps going? And I think some of these blend together, but as providers, we value your input. Mm-hmm.
I think just personally, having done my own little research out there, I think it'd be interesting to see if mindfulness-based therapies or acceptance and commitment treatments for like the higher functioning individuals would be added to the list, because there's more recent information out there about how that can help with emotion regulation and for individuals with comorbid mood disorders. So for me, I think that would be something that could be added.
Absolutely. Packages of interventions, transdiagnostic interventions. I think this is where we're headed as a field, because comorbidity is the rule, even in the case of ASD, especially in the case of ASD. Communication support, sibling training, very interesting. Yeah. The family system plays an important role in treatment, as we'll discuss a little bit later in this presentation. So we will have time at the end to discuss more and answer some questions, but let's dive in a little bit more into the evidence.
Thanks so much, Dylan, for leading the discussion. So now that we've kind of taken a look at the project, even though it was published in 2015, what we kind of decided to do is let's take a look at some of the more recent literature. And what we did is we looked at between 2016 to 2021. And although there was a lot of information to sift through, we kind of chose some of the ones that maybe are a little bit more relevant to the topic. So this article was an annual research review, and it looked at the state of intervention science. So basically looking at the targeted psychological as well as biological mechanisms for treatment, and also talked about future prospects. So, looking forward into what can be done in research. And basically, there's still a big need for higher quality research in the field of autism treatment. Although we know that ABA is the gold standard and behavioral interventions are the gold standard, there is still difficulty with having high quality research, meaning research that looks at uses randomized controlled trials. And some of the difficulties with this has been that although there's a lot of information out there about the interventions to use with children with autism, a lot of the research methods vary greatly, and not just in the US, but internationally. And when the research methods vary that much, it makes it difficult to replicate, which could make it difficult to then have these treatments be emerging or evidence-based, because again, it's not replicable. Also, this article discussed that of the evidence-based treatments available, emphasizing that ABA remains the gold standard, but again, recognizing that most of the research is based on smaller single case designs. There needs to be a push for, again, randomized control trials looking in ABA and also looking at the long-term effects of this intervention. They also found that early intensive behavioral interventions that include parent training remains most effective. So really targeting individuals on the spectrum at a young age and including the parents to help with that generalization. And then there's also just the need for study on the biological mechanisms. I saw someone in the chat mention that about the metabolic aspects, but also treatments in terms of pharmaceutical. Obviously there's nothing that is shown to be approved right now, but maybe research in the field of looking at like what medications can be paired with non-pharmaceutical interventions and if that is even useful or effective for children with autism or individuals in general. This next article reviewed the current available behavioral and developmental educational approaches to treatment that are usually used with individuals and children with autism. It was more of a review, so it wasn't really a study, and it also emphasized the efficacy of each. So looking at this, all the interventions that were included were looked at across various domains. So this included behavioral, developmental, school-based, language communication skills, social skills, and sensory integration. And of course, just kind of looking at the list here, we have ABA, discrete trial training, early intensive behavioral interventions, with those being the most effective. And again, this was published in 2019. And then you have the parent-mediated, and then in school-based, you have Early Denver or Teach Autism program, picture exchange systems, all of these showing to be effective, including social skills groups and video modeling. What was interesting that they did bring up social sensory integration therapies. However, they did note that although they're being used, there's still very sparse research in this field, in this area of interventions. And so they really couldn't say if it was effective or not. And this was, again, just in 2019. So there's a need for more research in some of these aspects, even though they are being used prominently in the field. And then this last article looked at the clinical update, implementing evidence-based emotion regulation treatments for clients with autism, which I kind of foreshadowed in my discussion. This was looking at trying to help individuals with autism who may also be struggling with comorbid mood disorders such as depression and anxiety. Okay, so they provided a synthesis of treatment on emotion regulation for treatment with autism, and they also provided suggestions for clinicians who do not specialize in ASD treatment. So this may be the provider who has, a private practice or who's working in clinic in a general type of setting, but then has a patient who comes in and indicates that they're on the autism spectrum, but is endorsing depression or anxiety. So, as someone who may not be familiar with working with people with autism, this article provides some suggestions, and we'll get into that list in the next slide. Moving on, they found that there's little research that has been conducted that looks specifically at the treatment of emotion regulation in children or individuals with autism, but there has been some literature. So it's not that there hasn't been any research, but the interest is starting to grow. And I feel that having worked many years with individuals with autism, unfortunately, this is an area that has been ignored, because even like Dylan said, people with autism aren't, immune from struggling with anxiety or depression. So it is important for us as clinicians and providers to start, looking at what are some of the non-ABA treatments that could be helpful. So in this article, they looked at a few of the treatments so far that are starting to show some efficacy. And they found CBT, cognitive behavioral therapy, specifically for anxiety, although not much evidence for depression. They also looked at mindfulness-based interventions, specifically for children and teens with anxiety. It was also helpful with depression and just overall emotion regulation. So even individuals who don't have depression or anxiety or just feeling, very overwhelmed, mindfulness-based interventions were also useful. And then they also found intensive outpatient programs that focused on emotion regulation treatment, or what they call IO-PERT, and that they combine that with either CBT or mindfulness-based interventions and ABA. So that's what these this IO-PERT combines these three aspects, and they found that that has also been very effective and helpful for individuals, so far with autism and comorbid emotion regulation difficulties. So some of the recommendations or suggestions that the article presented for the providers in this, who might not be familiar working with individuals with autism, but might have someone who's experiencing depression or anxiety, here were some of the suggestions and some examples. So just to kind of touch up on a few, maybe add a training in emotion psychoeducation. So this could be help the client understand that emotions are natural, even when they feel bad. Some other examples include using visuals to make other, concrete, even though emotions can be very abstract, which is something that we know individuals with autism may struggle with, using something as visuals to make it more concrete and more relatable. So this includes using maybe an emotional thermometer, using specific examples to help them anchor and understand better, for their own means, maybe using worksheets or props, and maintaining structure in session, okay? And then the other thing could be maybe adjusting the session duration, frequency, or location. So just really tailoring treatment to the individual that's in front of you while understanding their cognitive needs. So here's a little video about, how do you understand, what treatments are safe and effective for autism. And we're not going to play the whole video, just the first part to kind of summarize what we've discussed so far.
Hi, I'm Donna Murray. I'm Vice President of Clinical Programs for Autism Speaks. And today we're going to be talking about how do I know which autism treatments are safe and effective. At Autism Speaks, we encourage families to seek out evidence-based practice, although we know that's a challenge. One evidence-based intervention that we know about is behavior therapy, and it's proven to be effective across the lifespan in learning new skills, addressing communication skills, as well as social skills. In addition to behavior therapies, there are a number of supports that have also been proven to be effective. Things like using visual supports or schedules, as well as using modeling. And you can use real person modeling in real time, as well as video modeling. Challenging behaviors can be very concerning for families. One thing that we really recommend is that before you start an intervention for challenging behaviors, you have a functional behavior assessment. That helps your provider understand what might be triggering those behaviors. And then you can employ some of the behavior therapies that we talked about, or if you're still, or the child is still experiencing behavior challenges, may also be combined with medication. But it's really important to work closely with your provider when coming up with a plan for challenging behaviors. Some of the work that we've been doing in the Autism Treatment Network is doing a better job of understanding some of the medical and mental health conditions that co-occur with autism. And sometimes when we can treat these medical and mental health conditions, we see improved functioning. The common co-occurring conditions that we've been looking at in the autism.
So although this video can go on for a minute, we kind of just wanted to play that first part just to really emphasize what we've been discussing so far. And this latter part of the video is, best suited for a different topic, but just again emphasizing currently what's being used is the behavioral interventions, and then understanding that we need to address also the medical and mental health issues that individuals with autism also experience. So now that we've kind of discussed a lot about the evidence-based treatments, we're going to go into the factors, some of the factors and roles that parents and providers take. So understanding that parent role is finding the right treatment for their child. It is up to the parent to really figure out if the treatment that they're trying to take their child into is really effective and fits right for them. It's also part of their role to be an active participant in their child's treatment. It's not very effective for a parent to just kind of drop off the child to therapy and then, come and pick them up after. It really shows that parent training is very, very helpful and important for the generalization of the skills, not just in the treatment setting, but outside in the natural environment. And it's also part of the parent's role to ask as many questions as possible to their providers and to individuals to ensure that their child is getting the services that they need in order to succeed. So parents need to ask a lot of questions and be active and as involved as possible to advocate for their children. As providers or clinicians, our roles are including to be as empathetic as possible, to build rapport with the child and the family. So understanding that, yes, even though you're treating the child, again, to encourage parent training and parent involvement, you need to establish that rapport with the family. Going back to being empathetic, it's important for us as clinicians to understand that even though we have the training and the understanding of working with children with autism, we don't live with them. So we might be present for the child and the family 1 hour a week, or depending if you're doing ABA, several hours a week, but ultimately the parents and the families are with the child 24/7. So we need to be understanding and empathetic of the parents and the families when they come to us with stress or difficulties, okay? It's also part of our role to have the proper training and competence, to understand current literature, which is why we're here today, to encourage and promote parent involvement, have that collaborative approach with the family, and to have strong clinical judgment that is based not just on the research, but also clinical experience and the research. So a few factors to consider when seeking or providing treatment include various aspects. One of the first components is for the parent is for them to be able to know, like, the fact that their child cannot talk, or for themselves or for others, this may be increasing some aggressive behaviors. Okay, so kind of the parent understanding what are the factors that are affecting my child and that are influencing my child's behaviors. So when a parent is speaking to the therapist, it's important that they express the concerns that the parent has. So my child has these difficulties, these are my concerns. I need to communicate this with the therapist or therapist to be, okay? And then the therapist's role is to understand that some concerns may be more urgent than others. And so helping the family have that collaboration, that open communication with them to help tease out which concerns need to be addressed more like apprehended more frequently or more earlier on than others, okay? And then the clinician also may be able to see some areas of concerns that maybe parents overlook. So some parents might not see certain delays or developmental delays because maybe they don't know. So as a clinician, it's also important for us to be able to bring up those concerns with the family and discuss that with them. Another important thing to consider, or factors to consider, is goal setting. So I think we all here understand that goals need to be concise, observable, measurable, right? We need to be able to make sure that the goals identify the conditions under which the behavior is demonstrated, so the setting events, and to also understand what conditions or factors maintain the behaviors. So the reinforcement, what happens directly after, that's going to keep the behavior happening. And then also knowing that behavior and goals need to be continually reviewed. This needs to be a working document, a working process, collaborating with the family in order to make sure that treatment is being effective and progressing as it should. So thinking of goals as targets, okay, so what are the main targets? We need to talk about, understanding that every clinician needs to identify clear targets for behaviors, meaning they should not be vague, okay? They need to be as concrete as possible, meaning so for example, increasing social engagement is not as good as a target behavior versus increased child's responding when greeted by another. Okay, so you want to be able to have goals that you can actually measure. Another example could be increase how quickly child responds with parental requests within under 5 seconds. So you're able to see, okay, is the child complying within 5 seconds, etc. Other factors to consider for both the parent and the clinician is that ensuring that the clinician has the training and the background and the experience to work with the child on the spectrum specifically, okay? This goes for any field, right? So working within our competence, okay? And now it's important to understand if a clinician is within a training setting in an institution such as Nova University, it's important for the clinician or the therapist to divulge that information to the family, to disclose, I'm a therapist in training, but however, I am receiving appropriate and adequate supervision to work and provide treatment to your child. And then this goes for even, clinicians in training or established clinicians, we still need to be able to gather really good background information. So when you're first meeting with the family, understand what's going on. And then you also need to be familiar with current research and up-to-date information. So an established therapist who may have been doing treatment for the last 15 years, but hasn't really been kept up to date with the research, might not really be doing what's most effective, especially if, as you can all see with the project, things change over time as more research comes out. So it's really important for us as clinicians to stay up to date. And then also using data-based decision-making, meaning as clinicians, especially in ABA, a lot of data is collected, but even as providers, just collecting on how the child is progressing over time, and then using that information to decide how treatment is going to progress. Is it even progressing? Are there difficulties? Are there, setbacks? And using that data to make decisions to move forward. And then when it comes to licensure and certifications, knowing that, first of all, it's our roles as providers to be properly certified and trained. Right? I think I've already mentioned that. But it's also the parents' right and their role to really ask a lot of questions. So parents should not be afraid to ask a therapist or their supervisor about their credentials, their past experiences working with the population that's similar to their child, any kind of training that they've had, how many years they've been practicing, etc. Because at the end of the day, the parent should be, again, advocating as much as possible for the child, and they need to make sure that the provider is giving training or therapy within the scope. So when I say within the scope, meaning an occupational therapist should not be given nutritional information, or us as clinical psychologists should not be giving information or advice on pharmaceuticals or medical interventions, right? And parents need to know that, right? So if a parent is asking a questions to a clinician and the clinician is maybe giving out questions or suggestions outside of their scope, that should maybe be a little bit of a red flag, and parents should be aware of that. And then as clinicians, again, practicing within your competence. And then going back to data and using data to drive your decision. So understanding that especially in ABA, a lot of data is taken, data points. And then even as clinical psychologists, we also take data over time to make sure treatment is progressing and see how things are going. And that is our responsibility, because otherwise, how do we determine if what we're doing is working? Okay. It's our responsibility to be able to provide this information or this data to the parents, and to have ongoing review and discussion with the family and the caregiver, and maybe even the individual if you're treating someone who's older, maybe not just a child, in order to demonstrate to them how, hey, look, what we're doing is working or it's not working, or how do you feel about this? Let's kind of see where we need to go from here. Okay. And it's also important to know when you do present data, present it in a way that's easy to digest and understand for the family. Maybe don't present this very complex, elaborate graph, but do it in a way that the families can understand as well. And I know I've kind of discussed this already, but understanding that, parents' participation is very, very important. Like I said, they live with the child. They are with the child all the time, unless they're outside of school. So it's very important that parents participate in order to help the skills that we're working on in treatment generalize into the natural environment. Meaning a person who goes into treatment, they may know how to do things in a controlled clinical environment, but when you then take them out of that environment and put them into the real world, then they might stumble and get stuck. So really having that parent involvement can help these individuals, including children, maybe older adolescents, put those skills into practice if the parent is involved and knows how to help them through the challenges. And then some other factors to consider include some of these cultural, work consideration, family structure, and financial factors. So as a clinician, when you're putting together a treatment plan, it's very important to look at all of these different aspects and see, is this going to fit the family? So for example, for cultural variables, is there something specific about the family that would impact treatment? This could be religion, this could be, cultural background. So for example, it's known that in some cultures, it is actually considered very rude to look at someone in the eye. However, many, or if not most, of ABA interventions for children with autism focuses on eye contact. So it's important to understand in the context of the family's culture, is this appropriate? In terms of family structure, so it's important to know who lives in the home, who will be involved in treatment. So is this a multi-generational family? Is it just mom and dad, or just mom, or just dad? Does grandma and grandpa live there? Because when you're trying to get involved that parent training, then maybe it's not just parent training, it's also family and grandparent training, right? I can just say from personal experience, I've worked with families where their grandma lived in the home, and although if I did parent training, if grandma wasn't on board, then kind of everything we worked on would get washed away, right? So it's really important to involve all the caregivers in the home. So considering family structure, okay? Work and career considerations, especially with people with multi-income homes or people working all the time. Our schedule is going to impede the family's ability to do multiple sessions a week. So considering, the dose, the treatment dose, and how many times a week you'll do that, and does that fit with the family's schedule? And then financial factors, obviously treatment without insurance, even with insurance, can be very costly. So if you're suggesting, doing multiple sessions a week, is that going to fit in the family's financial, bracket, or is that going to fit, their budget? So as clinicians, we need to take into consideration all of these factors when coming up with a treatment program. And then as the parent, when they're looking at this treatment plan, it's important for them to consider their family, so your family as a parent. So they need to decide and have a conversation, does this fit with me and my family and the factors all here, and is it really right for me? Okay, and also for parents to understand that they're not stuck with whatever intervention they start with, okay? If the parent decides or notices that maybe the treatment plan isn't really working or is as effective as they would have hoped for it to be, then they have the right to have a discussion with the provider and to collaborate and to see what they can do to change. Maybe it's too much for them because of work considerations or financial factors. So, having that open discussion with the provider and the parent, and knowing that the parent has every right to advocate and to change things as needed. And also the provider has a responsibility to help the parent understand why some of the suggestions are being made. So again, a very collaborative conversation between the two.
All right, so now we have some resources for all of you. Feel free to take a picture of this next slide for reference. There's some great referrals there. So first, we have the National Standards Project, which provides a source of guidance for parents, for educators. I see we have a lot of educators present today, and treatment providers on evidence-based intervention options for ASD. So a good resource there. We also have Autism Speaks. We saw a video from that group. It's another great resource. They have a number of other videos that sort of provide families with information about how to pursue the process of ASD, not just the options, but all of the ins and outs that they need to know over this treatment endeavor. The Center for Autism and Related Disorders, or CARD, centers are a fantastic referral source for the state of Florida. They have a wealth of resources that are free of charge. And although they are not they don't provide much in the way of direct services, you can think of them sort of as a repository where families can go and find what they need. We also have Early Steps, which is within Children's Medical Services, and it helps families with infants and toddlers from birth to 36 months who have developmental delays or a condition that is likely to result in developmental delays. So these are direct services for supporting children through the state of Florida. So some great resources there. And in conclusion, we have treatments for ASD. They are evolving, and it's important for providers to stay up to date. So being part of this training is part of that process. Thankfully, there are numerous other resources that are also available to help you and your clients and the kids that you work with to sort through all of the information as it comes in. So here are a few key reminders from this presentation. This Shark Chat, while a very good refresher and an update, is no substitute for a proper training. So please ensure that those working with individuals on the spectrum have the requisite experience and competence and up-to-date knowledge, because otherwise you'd be doing a disservice to clients and their families. As a reminder, parents have a right to ask questions, and they should expect to be shown how their child is responding to the intervention approach selected. And in addition, parents should also know that they have an active role to play in their child's treatment and should be equipped to do so. So we are just about done. On behalf of our patients and their families, I just want to thank you all for taking the time to learn more about evidence-based treatments for ASD. I hope that you'll think of the team here at the Nova Unicorn Clinic as a resource to you and your clients and their families in the future. And now we have some time to answer questions. So please write them in the chat and we'll attempt to address as many as we can. So I know there are a few questions already asked. Let me see if I can get one started. So someone asked, how do you find appropriate treatments for kids who are higher functioning? This might include children who are diagnosed a little bit later on, children of color, girls who are underdiagnosed, etc. So team, where do we start?
Yeah, so definitely the CARD that we talked about, CARD organization, they definitely have a lot of referrals and lists there. You know, and obviously seeing what then there, if the family has insurance, what their providers approve for, but really starting off at, you know, when you want to get an evaluation. So even though they're a little bit older, it's important for an individual, if they're suspected of autism, to have an assessment, like a comprehensive evaluation, not just by a neurologist, but by a trained team, such as that we do here at DIC, so that we can understand really where their level is. And then to go from there, you would get recommendations for resources, within their community. But you could definitely look at CARD and go to that website, and there's a plethora of resources and referrals there.
Awesome. Thank you, Dr. Stubblefield. We have another question. What do you view as appropriate training for an LMHC to work with ASD in adults? It's a good question. One thing that I'd bring up is the idea that Dr. Silver, I believe, discussed, which is when possible, try to use interventions that are evidence-based. The more evidence behind it, perhaps the more appropriate would be for clients. Other thoughts?
Yeah, I would second what Dylan had said. So just kind of thinking back to that list of well-established interventions, some of the ones that were listed were cognitive behavioral therapy, which may be more appropriate with an adult who's diagnosed with autism spectrum disorder, depending on, their adaptive living skills and functional communication and such. You might want to integrate some sort of language training production. So really it will tie into the presenting problem, but definitely, as Dylan had mentioned, referring back to those well-established interventions.
Fantastic. Do we have other questions?
I don't think we have questions. I'm looking through the chat and I see individuals talking about like for educators and things like that. If you go back in the recording that will be posted, and looking at the slides that I listed for specifically the review the page with the article with the review, that one had, if you look up that article, there was a section on school-based interventions, and that could be a good place to start seeing like what are some of the programs. I know that the Teach Autism program, that's more of a school-based, maybe looking into that one or some other school-based interventions that they list within that article. I don't have those off the top of my head, but again, maybe for educators that we see there's a lot here, that could be a good starting point.
And I would second that, just kind of going back again to that slide with the well-established treatments, maybe focusing on some of the naturalistic teaching strategies. So those are the ones that are looking at helping children, in the home, in school, in their school, in the community, kind of using their naturally occurring activities as opportunities to increase certain skills.
I'm going to go back to the slide now, just so that, because we're not going to give out the slides, and just for the recording, I'm going to kind of do this. Oh, here it is, sorry. It's this one. So this article here, if you'd like to take a screenshot of the article title, you could look it up. And again, they had different approaches. They have behavioral, developmental, school-based. So looking at the different types of intervention programs for educators, this would be a good start to look at. And then in the resources page, I'll give people a second to take a picture of this if they need it. Okay. And then going back to the more well-established and established. So these were the emerging. So maybe looking at some of these that Danielle was talking about, and as well as these. So we hope that helps. So I think there's no more questions. I think we are all done. We thank you all for participating, and we hope this was very useful, and that you all learned something new.
Thank you all very much.
Thank you all.